And the question from Michelle is, are certain types of curves easier to treat or have a better prognosis than others? And so the answer clearly to that is yes. And the most significant factor is stiffness. So the very simple way of looking at scoliosis for the way we correct it with ASC is simply in terms of basically three types of curves. Your thoracic curve alone, thoracic curve that extends down into the lumbar curve, or lumbar curve alone. So a one-sided type curve for either thoracic or lumbar. And then a double. And the doubles are your S's. And the S's can be low or high, but they're basically an S. And as I've talked about in a lot of videos, they're not angulations like this, they're actually rotations. And the scoliosis origin is the fact that as you're growing, the surface ligaments stay tight and contracted and force the spine to spin around it so it can continue to grow. And that's where I think a little bit of the misunderstanding comes along in terms of what's the optimal way to correct it. Well, the optimal way to correct it then is a three-dimensional correction, right? It's not just a tilt. And then it's what technique is strongest at doing that. And I think over the last 12 years, we've developed a technique that is more powerful than by far VBT, which is the original technique. And that's actually now outpacing metal rods in terms of that three-dimensional correction by avoiding the downside of the junctional failures that come with metal rods or the long-term pain that comes with metal rods. But getting back to the question of, do certain curves have better prognosis or easier to treat? It all comes from the origin, which is that contracture. So if you have a 90-degree curve or 70-degree curve or 50-degree curve, but it's very flexible, it really doesn't matter how big the curve is, because it can be a 90-degree curve that bends down to 15 or 20. That's an easy curve to correct. But if you have a 50-degree curve that only bends to 45, that's a tough curve to correct because it's so stiff. And it then comes down to how you can loosen it in order to get it corrected. And obviously, if you have a very flexible curve to begin with, there's not a lot that has to be done to loosen it. It's already very loose, and we can loosen it a little bit more with the releases and taking the scar contractures out. And that allows it to get to that final correction. So the most important predictor of outcome is really the preoperative bend. And we do get bend x-rays before the surgery to see how flexible they are. But the looser it is to begin with, the easier it is to treat and the better curve correction you'll get. Because it's also an indicator of the adjacent curves. So if you have a stiff middle curve and we're only treating the middle curve, those other curves are going to be reasonably stiff too and have limited ability to balance what we correct it to. So the looser it is, the better it is, whether it's thoracic or lumbar or a double. And then you can say, well, in terms of treatment categories like under age 21 or under age 40. So those are categories where if you're under age 21, that's everyone bounces back easily from those kind of surgeries. Not everyone, I shouldn't say everyone, but it's a lot easier for a 15-year-old to bounce back than a 35-year-old. And so there are going to be some age restrictions going along there as well. So if you're under 21, that's the main group of patients. 21 to 40, another very successful group. You start getting above 50 and you're dealing with really stiff adult scoliosis, which is much more difficult, whether it's a metal rod or ASC to correct. And then I would just go back to the point of ASC's risk profile is much safer than metal rods from our data. And so if you're a 45-year-old having a metal rod, you have significantly higher risk than the 48-year-old having ASC, but it's the risk profiles related to age often. So anyway, I think I addressed that